Welcome to Doctors on Call. I'm Jenna Miller. Parent-child interaction therapy, or PCIT, is one of the most effective treatments for disruptive behaviors, noncompliance, or aggression in young children. It emphasizes changing parent-child interaction patterns and building on the relationship caregivers have with their child. Through PCIT, parents and caregivers are taught the same skills that mental health professionals use to improve child behavior. Tonight on Doctors on Call, we'll be discussing this and more regarding child-family therapy and mental health with our guests, Mandy Stock and Karli Kattenberg from High Plains Mental Health Center.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Local Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Mandy Stock is an outpatient therapist at High Plains Mental Health Center. Mandy is trained in parent-child interaction therapy and play therapy and currently provides services in Osborne and Smith Center. Karli Kattenberg is an outpatient therapist at High Plains Mental Health Center. Karli is also trained in parent-child interaction therapy and play therapy and currently provides services in Phillipsburg and Norton. Both Mandy and Karli have extensive experience working in mental health, having served as case managers at High Plains Mental Health Center prior to earning advanced degrees and beginning clinical practice. Give us a call at 800-337-4788 toll-free with your questions regarding mental health. Doctors on Call provides you with information that may be useful to you when you see your own physician or therapist. Thank you guys both for coming. We appreciate you making the trip over here, and let's get right to work. First of all, let's talk about what PCIT is and how it works.
Sure. Well, it actually was developed clear back in the 1970s by Sheila Iberg, and it has been around since then and kind of being refined over the years. And it really pulls on several different types of therapy shown to be effective with young children, attachment theory, play therapy, behavior modification, social learning theory. It really pulls from a lot of different things, kind of the best of a lot of different types of interventions with children in order to really build up the connection between parents and children, whether they're struggling in that area or whether we're just building on an already great and warm relationship. And then also focuses in on limit setting and listening and compliance with directions.
And a lot of what we do is teach parents how to use some of the skills that we use in play therapy at home with their child. So it's kind of like real-time coaching where we will provide coaching to the parent to build those skills so that when we're in a stressful moment, we're reaching for something, maybe previously we'd reach for yelling, raising our voice, or threatening punishment. Now we're going to reach for these skills that we've built up in therapy that can actually be more effective in managing behaviors.
Excellent. Now, what if a family decides that PCIT is for them, what can they expect at their first session?
They can expect to awkwardly play while we watch it. I'm sorry, I'm a little silly about that. But we do a play assessment and we measure the skills. We also use the ECB is what we call it, but the Iberg behavior rating scale to measure where these behaviors are at this week to make sure they fall within, that they have enough big behaviors that PCIT is going to be effective for them. And then after that we go into teaching, and then we go into coaching. So the first 3 sessions essentially is what that would cover.
Excellent. And what ages of clients are ideal for PCIT?
Sure. So PCIT is evidence-based, meaning they've done the research, they know that it's effective with ages 2 all the way up to about a kiddo's 7th birthday.
Okay, excellent. Now, you both have mentioned play therapy. Yeah. Let's talk about what is play therapy.
Yeah. Okay, so play therapy kind of operates under the assumption that children, because their language hasn't developed fully, rather than communicating verbally, they do a lot of communication through play. So they will play out their emotions, and as a play therapist, you kind of support them in adding, the words that go with that, and helping them process and just being a safe place for them to process their emotions through play.
Absolutely. And what types of behaviors or concerns may indicate a mental health challenge in young children?
Well, every child is going to have tantrums at times. That's just part of being little and figuring out the world. And but if tantrums and problematic behavior have become very difficult to manage for parents, if we're seeing a lot of aggression towards others, and we're just not able to, listen or comply with reasonable adult expectations, then that's usually when we know that PCIT might be a really good fit.
Absolutely. And at what point, you kind of touched on this a little bit, but at what point does a caregiver know that, PCIT might be for me or our family?
That's really kind of a conversation that they have with us, sort of. We help them determine whether or not it would be a good fit. There are some specifics about the intervention that make it a little bit different. Play therapy tends to be more of an individualized structure with the therapist and the child, and a parent comes sometimes, participates some, but PCIT focuses on the parent and the child together. So as far as deciding whether PCIT is appropriate, that's kind of a decision that we would all make together, and we would kind of make the recommendation on that based on what parents are reporting with trouble with behaviors and different things, and also just whether or not we can make it work with some of the other sort of things it requires from the family.
Yes, and I think in our experience, PCIT has been pretty much like, I don't want to say a last resort, but it's like we don't know what to do, we don't know where to turn, and that is a point where a lot of our families have gotten to, is like, we have a spicy kid, they're not listening, and so they come in and in a very short period of time, even though it's kind of intensive doing weekly therapy, can see just a complete change in the relationship, not just the behaviors, but the whole relationship.
Absolutely. And typically, how long is a family in PCIT?
That's a great question. I think we're learning that as we go this year. We trained on PCIT at KU Med in Kansas City over the summer, and so we've done it through several seasons of the year now, and so sometimes you're in it for longer if we have to cancel for reasons of weather and illness. This has been kind of a brutal winter for PCIT, I would say, and all kinds of therapy. They do say 12 to 24 weeks is kind of the standard, which is kind of a big variation. 3 to 6 months just kind of depends on the speed that we move through.
And compliance, because there is, like we said, the weekly therapy and then special playtime 5 minutes a day, which is a big commitment. So it depends on everybody being able to make all those parts function together. But
that's the reason for kind of the variation, I think, between a few months to maybe half a year. Yeah.
Sure. And we talk, I know, specifically, like, let's say with physical therapists, about how important it is to go home and do your homework.
Yeah.
How important is that with PCIT?
Oh man,
imperative.
It is. It's really everything.
You can tell as we're coaching in the rooms. You can tell when a parent has been following through. A parent and kid have been following through at home, because it is like, what skill do we grab first? Is it coming more naturally? And it's not from a place of judgment, but it is just to say, we're not going to be able to use these skills in real time situations with our kids if we're not practicing during this, time where we don't have these intense emotions going on.
Absolutely. Mandy, you mentioned something about attachment theory. Can you explain what that is?
Sure. So, oh goodness, Bowlby, and I'm not going to remember the name of the lady that really pioneered that, but just kind of realizing how important it is for children from the minute they're born on, especially those first 3 to 5 years of life, to have a positive and healthy relationship, attachment with their primary caregiver, meaning just simple things like, are my needs going to be met, fosters a secure attachment. So every time we change a diaper, every time we hold our babies and do the things, that's creating a secure attachment. And so,
which impacts how we perceive the world.
Absolutely.
So if we believe that, if we have a caregiver that's safe and predictable, they provide for our needs, we're going to feel pretty secure just being on planet Earth. If we have a really unpredictable caregiver, or we don't have all of our needs met, then we're going to have, higher anxiety or more depression, or we're, not going to believe that the world is a safe place to be, which is a really hard thing.
And some families have had just kind of some disruptions in that process of building attachment just through different things that have happened with work or with just, family separations.
Medical
or
emergencies.
Yes. And so we kind of rebuild on that, and that child's able to kind of
Heal
more
that.
fully
Heal that attachment.
build that attachment back up.
And it's a
secure
beautiful
way.
It's a beautiful process with PCIT to
really
watch. You're not during the first half of it. You're not correcting behaviors, and to watch a kiddo go from every time a parent picks up a toy, they take the toy out of the parent's hand to sharing with the parent. We've never taught that behavior. We've not like verbally, right? But by the end of PCIT, it's like, oh my goodness, this kid feels okay sharing the resources with their parent or caregiver.
And actually, Jenna, when you say that about attachment theory, that is one thing about PCIT that is unique and really neat compared to play therapy, which Karli and I both love to do. But what they kind of found out through the years, and the reason that PCIT developed is, as well as other interventions too, play therapy, while it's fantastic, it focuses on the connection between the therapist and the child. But they're still going home with their family the whole rest of, the week. And so this basically takes, as Karli said at the beginning, the power of play therapy and instills it between the parent-child relationship. And so just that's where you get that connection fostering and growth so quickly.
And it gives parents permission to just enjoy their kids.
Yes.
Because when you have a kiddo who's spicy, big behaviors all the time, you can get kind of caught up in the day-to-day. And Mandy and I both have kids in the age range. We both have 2 little girls at home. Each of us do. And we get it, like parenting is never perfect. We have all of this training and we still find ourselves going, oh, I could have handled that differently.
Yeah, absolutely.
Wonderful information. Let's talk about where PCIT is currently offered at High Plains Mental Health Center.
Sure, yeah. So we do have a third cohort who's not here with us tonight, and she works in the Hayes office. So she offers PCIT in Hayes, our friend Adria, and then also in
Norton and Phillipsburg
with Karli, and then I offer it in the Osborne office. It's also a modality that can be done via telehealth, actually, which is another thing that makes it unique. It can be done via telehealth from a family's home. So because it is more of a coaching intervention, the parent and the child can be in the home, and then we can actually meet with them from basically anywhere to provide the service. So that's another neat aspect of it.
Absolutely. Now, do you find it's a little better, it's about the same going from person to person or via telehealth?
Yeah,
it's about the same, I think, because again, it's, not about me as a therapist building that relationship with the kiddo. It's more about honestly, it's the relationship is built more between therapist and parent, but mostly between parent and child. As long as we have a good setting for that at home, it can be just as effective.
There's a few housekeeping things that are a little bit trickier with telehealth as far as assessments and things like that, but and technology requirements and stuff. But it is a good modality for
and especially
Zoom.
out here in rural
Yes,
America.
absolutely.
That's wonderful to know. So let's talk about who might not be a proper candidate for PCIT. Or is there such a thing?
Well, actually, one thing that we say is that, so PCIT is broken up into 2 phases, and I won't go into that a lot, but the first phase is called CDI, Child Directed Intervention, where the kiddo is in charge of play and the parent is playing along, and we're coaching the skills that Karli was referring to. The second segment is parent-directed intervention, which is where we get a little more specific with addressing problematic behaviors and improving compliance, while still doing all the positive things to make sure the relationship is nurtured. But I would say, we do say sometimes in our training group that everybody can benefit from CDI. It's just a good, warm connection building intervention with families. Yes. So in that way, there really maybe isn't someone who's not a great candidate, because CDI is beneficial for so many. I mean, we use it at home. I use it at home with my kids, and
through positive attention alone, I think is something that all parents and anybody who works with kids can really benefit from, because we know that that's more effective, right? To positive reinforcement for positive behaviors is going to work better than the negative reinforcement, or you know, scolding a kid when I know as a parent I always want to.
I think it really does come down to if a family, you know, assesses where they're at and they say, I just really can't commit to an hour to an hour and a half, you know, of weekly, or sometimes we can do a bi-weekly structure of therapy with my kiddo in the, you know, at home or in the office, and or I can't commit to the 5 minutes a day of special playtime homework that we assign. That might be a situation where it's just not always the best fit, because those things are required in order for the intervention to truly work well.
Sure. And we don't have to talk about this long, but what about, how do you accept, as far as, do you accept insurance, or how
Sure.
a family goes about paying for the services?
Yeah, great question. PCIT itself is not any different fee-wise than family therapy in general. So people who maybe are already getting family services, or a kiddo getting individual services at High Plains, there's no catch, I guess, as far as that goes. It's not an additional anything in that way. We do accept major insurances and Medicaid, and we also have, the sliding scale as well for payment for fees.
Sure.
So
you might explain that real quick, what the sliding scale is.
Okay. So like it's income based, where if you feel like either you don't have insurance or you're not able to pay the full amount or your copay, then you would provide us some financial information, and we pay a percentage of that based on income.
Okay. So uninsured or even just underinsured, if it's cost prohibitive, we do have to try to make that accessible.
Okay, very good to know. Now, if a family is considering therapy, but they just don't know, what encouragement might you give them?
I would say go for it. My daughter is in therapy and case management services at High Plains, and it is just wonderful. And also, the younger they are, the more of that attachment healing that we can do, not just attachment, but the more of like learning and reducing anxiety, learning coping skills, because the brain, you know, is so ready at that age. I would say, especially if you're seeing lots of big behaviors in your 2 to 7 age range, you want them in PCIT, because that's going to help, because when they're 14, you can't pick them up and move them.
That's right. Yeah, that's very right. And I think just in general too, I mean, most kids love coming to therapy appointments, and it's a positive experience, I think, for most of our families that we get to serve.
Yeah. Absolutely. What does and not just maybe with PCIT, but what in general does a typical family therapy session look like?
That varies a lot from situation to situation. We might be working on communication. We might be working on, again, just kind of building some more positive bonds and attachment depending on the age of the child. Just specific stressors that have come up too. We can process that in a family setting, and
we can even do play interventions with families. I do a lot of sand tray interventions with families, because communication is just such a big thing that we all kind of struggle with at times, and it gives kids especially, but even adults, a mode of communication that is external. So it kind of removes some of that heightened emotional state, so they can say it in the tray and talk about the sand tray, rather than I feel this way, that person feels this way about this in our family, or whatever.
Yeah. Sure. And well, we were talking about play therapy. If a person maybe isn't having play therapy per se, how important is it to get your kids out and play with your kids?
So important.
Yeah.
So important. So many social skills that they learn. Just the attachment building that we do every day with, you know, individuals, that they do every day with individuals in their lives. It's so powerful, because the more good attachments they have with healthy people, the healthier they're going to be, the more they're going to feel like they have a good support network if they do have something that's bugging them.
And adults need to play too. I'm guilty of that. We don't always realize that we do, or recognize that we do. But when you do sit down and play with, it's pretty awesome.
And how important is it for the adults to maybe put their phones down? Sometimes you'll see, a parent pushing their kid on the swing while they're looking at their phone. When do we need to put them down?
So first of all, we all do it,
Yes,
right?
right.
Like
We're not-
we all check out sometimes.
My kids would say, Mom, or yeah.
But I think I can't remember exactly the research, but they said in our training, kids under 5 get maybe a minute of playtime with their parent or caregiver a day on average. And over 5, it goes down to like 30 seconds. Or maybe it was 3 minutes and a minute. I can't remember for sure. I'm so sorry. But just recognizing that that's how they communicate. That's how children communicate. That's how they know that you're interested in them. That's how they know that you approve of what they're doing. Your words are important, but your actions are more important. So if they see you saying, hey, good job on playing soccer, and when they look up at you, you're not looking at them at all, like that's going to communicate something very different than what you're trying to communicate as a parent.
Yeah. I read something the other day that talked about, like, when they say mom, when they say dad, that's the minute that you know for sure. Put it down. Put it completely down. Give them your eyes and have that conversation. It doesn't mean that you might not go back to it later if they're playing independently, but every time they need your attention, that's a good... It's probably a harder bar to reach than we realize. But
you would never be playing on your phone while your boss talked to you.
Yeah.
Think of it that way. Is like, okay, if I would give my full attention to a grown up in this moment,
Right.
like it is also important for me to give my full attention to my child.
Absolutely. Great advice. Let's talk about family seeking therapy and how important goal setting is.
It's so important. The goalpost can move if we're not careful. So we have to set really intentional, smart goals. And this is why with PCIT we use that ECB, because we can say, hey, we started out at a 176, and when we were doing our homework, we noticed that it came down to a 147 or whatever. I know those numbers mean nothing to anyone, but we can measure it. Because a lot of times it doesn't feel like we're making progress when we actually, they haven't been yelling and screaming at bedtime like for several weeks. That's big improvement. It was every day, so.
Yeah, goals direct the work that we do in every session, really. Yeah.
Sure. And what kind of privacy policies do you follow when it comes to your clients?
Oh, man. We have very good, I think, and clear... So, of course, we have to adhere to HIPAA privacy practices like every healthcare entity. But actually at High Plains, we have some increased steps that we take to protect our clients' privacy. We live in small towns, many of us, and so we have the conversation with people about, this might seem strange, but if we are standing in line next to each other at, checkout at the grocery store or at Casey's, I'm not going to approach you. I don't want the people around you to say, well, how do you know that lady? And it's not because we feel anybody should be embarrassed that they're getting therapy. We just want them to be in the driver's seat of that.
Exactly.
So some kids run up and give me a high five when they see me in the community. Sometimes older kids walk by like they've never seen me before in their life, and I tell them that doesn't hurt my feelings one bit,
And I always tell clients it's your session.
Yeah.
You get to decide, and that includes you get to decide
outside the session.
Yes.
How we...
Absolutely. Now, in general, for the children and family therapy, is therapy recommended for long term, or is the goal to, heal and move on and, go to the next thing? What is the goal?
Great question.
The goal is always graduation, right? Like I love that, and I know it's a very bittersweet thing for me and for families when they do graduate. But it's kind of like moving on to the next year in school.
Yeah.
That being said, there are times where it's appropriate to have very long-term therapy.
Support, yeah.
And it is just very much a case-by-case, family-by-family basis.
And we're not going anywhere. We're always here.
Yes.
So if another period of time comes up where something tough is going on, we'll always be available.
Yeah. Come back, get the support you need.
Sure. And when might medication be a good option for those struggling with their mental health?
Well,
Good question.
yes. So Karli and I are neither one prescribers, and so we can't really speak to the specifics of that. But we certainly can, I would say, recommend or have that discussion with parents if we're trying lots of other things. And if a parent is curious, I do really appreciate about our medication providers at High Plains. They're always happy to have a conversation with parents for a first appointment with them, and there's no obligation, so to speak, to decide to, pursue medication, but they're always happy to answer questions and do those things. So those are kind of like some of those more nuanced decisions they would make with their medication provider if they were interested in that. But we can have those talks.
Yes, and I find a lot of comfort in being able to talk to your provider about your concerns. And again, like she said, that's what we encourage is, I can't speak to that, but I can also say that medication can make a very big difference for all of us if it's appropriate. Yeah. And that would be up to, you and your provider.
Absolutely. We have just a few seconds left. What's some encouragement you might give to a client that's thinking about PCIT or therapy?
Sure.
Yeah. We have a lot of fun.
Yeah, it is. It's very fun.
It's not about judging or, your parenting skills aren't good enough. It's absolutely not that. It's just, sometimes kids are spicy. Yeah. Sometimes we need to work on those skills, and that's okay.
Something new to try. Mm-hmm.
Yeah, absolutely. Well, thank you both for coming and joining us tonight on Doctors on Call. Our thanks goes out to Mandy Stock and Karli Kattenberg from High Plains Mental Health Center for being our guests tonight on Doctors on Call. On our next Doctors on Call, we'll be discussing knee injuries with physical therapist Troy Moore. If you have any questions regarding that show, you can always email us at doctors@shptv.org. Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.